In recent years, there's been a big change in the comfort level of men discussing impotence or erectile dysfunction. I can remember several years ago I had to bring the issue up to my patients, and nowadays, I think because of the knowledge that ED or impotence is so prevalent among men with diabetes, about 60% of them have the disorder, that men are much more comfortable about mentioning it to me and to other providers, and also discussing treatment options. So that's been a big change in the last 5 to 10 years, and I think that occurred with the availability of drugs that offered some hope to patients, such as Viagra. So we do have other treatment options for that. Also, the recent knowledge that many of these men have low testosterone levels, and that by detecting that, diagnosing that deficiency, we can treat them with supplemental testosterone and not only improve their erectile dysfunction or their impotence, but also improve their overall sense of well-being. And they tend to have better muscle mass and a little better stamina when doing exercises. So that's been a recent change in treating erectile disorders in men with diabetes. So if you're a male patient with diabetes and are having some problems with impotence, don't hesitate to discuss it with your practitioner, because there are very good treatment choices and a spectrum of treatment choices that you can use to achieve normal sexual function. Patient foot care is very important. Individuals with diabetes should periodically strip off their shoes and socks and take a good look at their feet. That means looking at the skin, looking for any breakup in the skin, be it dryness and cracking, or an early ulcer, a callus or corn. Pull your toes apart, look between your toes, because that's an area where water can be held and patients can get some skin breakdown between the toes. Look at the health of your nails. If your nails are too long, they need to be trimmed. If they're thickened, that needs to be treated. If patients have calluses or corns, those should be trimmed back. So it's important that you get to know your feet. And the only way you can do that is by frequent and thorough examination, including between the toes.